Hi, everyone. This is Dr. Leaf Rogers, plastic surgeon, and this is another plastic surgeon.
Dr. Walter Joseph.
Okay.
Good to see you guys.
And we're doing another episode of SOMA Living. So that stands for the standard of
Modern aesthetics.
and living.
Yeah.
So today we're going to talk about men's health. So which includes things like TRT and hormones, otherwise peptides, other things you can do to improve your overall well-being as a guy.
Yeah.
Yeah.
I think, it used to be that women kind of were the ones that cared about how they looked, but I think more and more it's just becoming more mainstream for men to optimize themselves. And of course, wellness, longevity, biohacking is all the rage right now. So I think it's fun for guys to get involved in this stuff.
Yeah. No, and I've seen this slowly happening literally over the last 20 years.
Yeah.
So it's been a little bit. I mean, I think it's honestly it starts obviously with athletes, right? I mean, that's really where always it starts. You see these guys in great shape and you wish you could be that way. But then you see where it crossed over a little bit in the aesthetic world where men are starting to get like Botox and stuff. Brotox, people are calling it. That was the beginning. Dipping your foot in the pond. But now I think I think people don't want to have just dad bods anymore. They want to be a dad and they want to be buff, right?
Yeah.
I do. I don't want a dad bod.
Yeah, and I feel like there's no reason that someone should just settle for that.
Right. But it's not just looking good, obviously. It's feeling good. And that's the older I get, the more I realize that. I mean, it's so much about feeling good. Yeah. As we age, and everyone out there is probably over like 40, 45. 40 is when you start noticing, by the way. And 45, 50, that's when things start to actually hurt. And especially if you were a former athlete. So because when you push your body that hard when you're young, you don't notice it when you're young.
Yeah.
You notice it when you're a little older. Like joints start to ache, things don't move as well as they used to. Just the idea of like, I got to get up and go to the gym is a little harder than it used to be.
Yeah. Just overall, again, like you said, just those aches and pains, just overall energy, wanting to do your usual activities. So like when do guys start to have a testosterone drop roughly?
So it depends, but I would say the majority of guys start noticing a significant drop in their early to mid 40s. So, but everyone's a little bit different.
Yeah.
I mean, I have some friends who are like in their late 50s and their testosterone is still like 800.
Yeah.
And then I know there's lots of young men now, and it's a whole epidemic now. Apparently, young men who have low testosterone, it's just baseline low.
Yeah.
And nobody really knows, but there's a lot of theories as to why.
Yeah.
I mean, it could be like microplastics, phthalates, hormone issues, like insecticides or herbicides and stuff that
pesticides,
are things like in the food that we eat. So who knows exactly? But there's a lot of things that do affect our hormones to some degree. That's in the environment.
Yeah,
could even be a whole generation ago. Like for instance, they're saying a lot of the stuff affects our moms and their hormones were different, which affected our hormones in utero. Yeah. So these are all theories that I've heard. And I think there's a lot of validity to all of them. I think it's probably not one thing. It's probably lots of things.
Right.
Regardless, at this point, we have to kind of just deal with it.
Yeah. Did you see that one study where they looked at like post-mortem, they looked at like male testicles and how the amount of microplastics that they saw in almost like every male specimen in the testes themselves?
Interesting.
Yeah.
But specifically in the testes? Or, I mean, it's in all the tissue, I'm guessing, but... somehow it's
maybe or
it's
more concentrated there for some reason.
Huh.
Yeah. I think it was like, don't quote me on this, but I want to say it was like 9 out of 10 specimens.
Yeah.
Like an overwhelming majority.
Yeah.
The microplastics. Yeah.
And then probably the ones that didn't have it like grew up in Tibet or something.
Yeah. Crazy.
Yeah.
I mean, again, who knows? I mean, that's not just like we said, it's multifactorial. I think, like we talked about, like I touched on last episode, when I was 32 or 33 out of residency, I think like the stress of residency, the lack of sleep during residency, just the unhealthy life of residency, being a resident and being a shift worker, my testosterone was like 230. So, what are normal levels? Or let's touch on that.
Well, if you talk to you like your insurance company.
Yeah,
For
yeah.
instance, anything over 300 is considered normal.
Yeah.
And it depends.
Yeah.
So so here's one that actually matters your genetics, your ethnicity. So really different ethnicities have different
Yeah. This is a
normal
good point.
testosterone levels. So people of African descent tend to have the highest. So they can range anywhere from 500 to 1200, and that's actually within normal limits. So because of that, though, they kind of use that as the normal high limit for everybody, but that may not be ideal.
Yeah.
The lowest, ethnically speaking, are Asians. So Asians are more like in the 300 or 400s. That can be normal.
Yeah.
So it's so normal doesn't necessarily mean like if you have a normal low amount like in that range, it doesn't mean it's too low.
Yeah.
If you feel good, it's all that really matters.
Yeah.
If you don't feel good, you may need more. So what that optimal level is for you may not be exactly the same it is for somebody else.
Right.
So I can tell you that for me, when I was in residency, I tested my testosterone just out of curiosity.
Yeah.
And my testosterone was like 350, which was
also low.
Low.
Yeah.
I didn't notice a difference though. At that time, I felt fine, had plenty of energy.
Yeah.
I was working out. I could build muscle. But as I've aged, oh my God, it really made a difference.
Well, that's the thing. I think we get so used to our baseline in our everyday. Like even when I did my levels, I didn't feel particularly fatigued or I wasn't like depressed or anything like that. I still felt good. But once I did start replacement, then I was like, oh, okay. Like now I get it, you know? And I think that's where people are seeing the benefits.
Right.
Yeah.
Well, I mean, part of it also may be because we're both half Asian. So we may actually have a little bit lower than someone who's Caucasian, Hispanic, or of African descent.
And I think it's a good point too, because I know at first, when you see a level in the low 200s, you want to, get that up. And I certainly like overshot, when I first started TRT.
A little overzealous.
I think I was doing like 80 milligrams twice a week. And I think I skyrocketed to like almost 1500.
Yeah.
And I was puffy. I was getting acne. I like just looked swollen.
I remember when you were looking puffy.
Yeah. No, but I remember like telling you, I was like, I think I'm taking too much. And I was probably just converting to estrogen too much. And
then you get gynecomastia.
Yeah. So then it's just, that's why it's also important to monitor these things. So we say, if you're going to make a change in your regimen, you need to get blood work within 3 or 4 weeks from that change to assess where you're at and where your new baseline is. So, I think that's a really important part.
Because too high testosterone is not good for you.
No.
So there are problems you can get from having testosterone that's too high.
Yeah.
So it can affect all kinds of systems. So your body has evolved to have a testosterone level within that range.
Right. Where you live. I always say like,
so, of course, we know of all the stories about the bodybuilders who have ridiculously high testosterone because they use like all different kinds all at the same time. And that does help them get enormous. It does work, but it's not good for long periods of time.
Yeah.
Now, for short periods of time, a lot of these guys, they've retired and they actually live relatively normal lives with not that many problems or have no problems. But it doesn't mean that you have no problems.
Yeah.
One of the issues is you can have kidney issues, but sometimes that's actually more from diet than anything else. You can have liver issues.
Yeah.
So that's partially because some of the synthetics out there have these big long side chains to keep them in your system longer. And it's hard on the liver. The liver has to break that down.
Well, let's touch on that too, just before we get into the rest of the risks. I think that's where some people are confused about, testosterone replacement is, people talk about taking steroids.
Right.
So testosterone replacement therapy is different than, say, taking steroids in the sense that a lot of times in weightlifting or in bodybuilding culture, they're using like synthetic steroids. Right.
Yes. They're using synthetic steroids that have been developed for all kinds of things.
Right.
And some of them are not even used for anything anymore, except for the sort of black market, to build muscle.
Yeah.
And some of them are very, very effective in building bulk.
Right.
But those are also the ones that, there's more risk. Yeah. So what we're talking about is not that.
Right.
Now, but the reason I wanted to mention is because even that, a lot of these people did for many years, and they have relatively few issues considering. So even super physiologic levels for relatively short periods of time seem to be relatively safe, though I don't condone it. Your cholesterol is definitely going to go up, and that's linked to heart disease and all these other things. So, but the best thing to do is just to keep your levels within that range.
Yeah.
Low testosterone actually has issues too.
Mm-hmm.
So low testosterone can predispose you to certain types of heart disease as well and other things. So really having that testosterone in the middle is ideal.
Yeah.
And of course, if it's very low, you can also have erectile dysfunction.
Right.
So that depends. I mean, can be age related. That can be related to other comorbidities too. But it can directly be related to that as well.
Yeah. One question that I get asked often, or among people who are interested in TRT, is about hair loss too. So the reality is that yes, adding testosterone or taking exogenous testosterone can increase hair loss. And I usually say if you're prone to it, or if you have a tendency to lose your hair because of either male pattern or female pattern baldness. So what happens is testosterone gets converted to DHT, dihydrotestosterone, which then is what causes hair to fall out.
Right.
So,
but you can block that step.
You can,
and so you can protect yourself from it, even with high testosterone, higher testosterone. So things like finasteride, that will block.
Propecia.
Yeah, so that can block it. So there are some companies now making like topical, which I'm not sure if this FDA approved yet. Is it?
That's a good question. I'm not sure,
but I know it's available, so you can get it. So topical finasteride seems to be effective. Now, minoxidil, it works, but that's not. It's a little bit different. That's works in a different mechanism. It doesn't block dihydrotestosterone. It actually increases blood flow. They think that's the main mechanism.
Yeah, and I think because a lot of guys are worried about the systemic side effects from Propecia or oral finasteride. Most commonly, some sexual side effects.
Yeah.
So some guys can have erectile issues on Propecia.
Low libido,
depression, anxiety. And I think the studies are pretty good in terms of topical.
Yeah.
So I don't really have hair loss luckily in my family, but I've been doing a topical of finasteride and minoxidil for a while now, just as preventative.
What about the Asian side? Is there anybody on your mom's side?
Not a ton.
No.
Yeah.
The Asian hair loss tends to be a little different. Yes, there's the same kind of patterns, but a lot of times they get that wispy hair.
Yeah.
My grandfather had that.
Okay.
Sorry, Leland. My brother has
Oh,
that.
God, yeah.
So I don't know if I should mention that, but luckily I didn't get that. But I am definitely, it's receding this way. But I'm 55, and it's not bad for my age, and I've been on testosterone replacement for over 10 years.
Do you do any minoxidil or
minoxidil?
Just
minoxidil. Yeah. But I should probably try other things as well. I can notice it is progressing slowly.
Yeah.
So at some point maybe I'll do something.
I always tell my patients, I think it's worth thinking about and considering before it happens, right? Because that's when it's harder to treat.
You're talking about hair loss.
Yeah. You want to get ahead of it. It's not. I almost tell everyone it's really never too early. Especially if you have it in your family, or you see a sibling, like an older sibling.
Prevention is way better. You need because once the hair is gone, it's not coming back. Once it's truly gone, you can get what do they call it? Miniaturization of the hair follicle, where it gets kind of small and thin.
Yeah,
that potentially can be reversed, but once it's gone, it's not coming back.
Yeah.
Then you need to do a graft. You got to take it from somewhere else and move it.
Right. Yeah. And then even things like increased your hemoglobin and your hematocrit, that can have some risk as well, and that's another side effect.
Well, if it's too high.
Yeah. If it's too high.
So doing too much testosterone can increase those numbers to the point where you actually have increased viscosity of your blood.
Right.
So it can increase things like certain types of strokes or potentially even heart issues. But it doesn't seem to be as common as you might think it would be. I've operated on guys who have very high hematocrits, hemoglobins, and on testosterone.
Yeah.
And the blood it's weird. It's almost like slime. It's like tacky and thick. It's really interesting.
Yeah.
But you would think they'd have more problems with it. Like, how does that flow through the little capillaries?
Sure.
But I mean, they seem to be healthy, no other problems. But still, I don't advise it.
Right. And all these things, I think the main point is that all those things need to be monitored. Your levels need to be monitored, and if you are going to make changes, then you need to get rechecked.
Yeah. So no, it's very important to be monitored. You don't want to be out of whack. So once we start, all right, let's put it this way: the easiest thing to do in terms of being healthy is nothing. Just the healthy thing: eat well, exercise, and don't worry about anything else. But that doesn't solve everything, and that is that potentially can happen to you, or the things that start to go downhill. And as we age, naturally things do. That's just part of the natural aging process.
Yep.
And there are people out there who believe we should just follow the natural aging process. This is how we evolved or were created, or whatever you believe, and that's how it should be. I don't necessarily believe that, because you have, as far as I know, you have one life to live. You want to do the best you can. You want to feel as good as you possibly can feel. Especially me, I'm 55 and I have young kids. I want to make sure I can keep up with them and do all the fun things that a young dad would do.
Yeah.
So, why don't we leverage modern medicine and the understanding of our physiologies to try to do the best we can without causing harm?
Yeah.
So,
and we're in a constant battle, like we already discussed, with the environment, right? And so we're not just, it's not about just
natural aging anymore.
Yeah, we're now at the mercy of the environment that we live in,
that we created.
Yeah. And again, that we're at the mercy of. And so, it is kind of a uphill battle. And so sometimes I feel like we need these things to help us through some of those.
And we can say, yes, we need to fix the environment. I mean, I don't disagree with that, but for most of us, we've already been affected. It's not like we can do that tomorrow. We're talking about generations of potentially correcting some of the things we've caused, in our environment.
Right.
But until then, we need to do something about that.
Yeah.
Like some of these microplastics, I mean, that stuff, that's not coming out of your system. That's in your body. You're not removing it.
Right.
It's there until you die.
Yeah.
So maybe future generations, we can eliminate that, but it's not going to happen for us.
Yeah. I know, we're stuck with it.
So TRT can affect your fertility. So that is one of the things you have to be aware of.
Yeah. So I always try to explain to my patients that your body naturally produces testosterone. Almost all of our hormones are in a feedback loop mechanism. So we know that testosterone is produced by the testes. And when we inject ourselves with testosterone or give ourselves exogenous testosterone, which means from outside our body, then that tells our body that, now there's testosterone in the body. So your brain stops signaling to your testes to produce more testosterone. So that whole feedback mechanism shuts down. So your body your testes basically stop producing because of the testosterone you're taking.
Yeah, our body says we have enough. We don't need to make it anymore.
So the downside of that is you could have a decreased sperm count. You could have a decreased volume of your ejaculate. You could have what else?
You can have reduced size of your testes. That's a big part.
Atrophy.
Yeah.
Yep.
So the part of the reason why that affects your sperm count, even though your levels in your bloodstream might be higher than they were before, is because to make sperm, the testes make sperm too, and they need really high levels of testosterone, really high. But since it's being produced right there, locally, it's really high. So that's why it doesn't work so well. So the way we fix that is we can give a different hormone to stimulate your body to stimulate that axis. So your body starts to tell your testes again to start making testosterone.
Right. And which is
oh my gosh.
Oh,
okay. It's
okay. Start. And which is?
No, I forget. What is it?
Oh,
HCG. That's right. Yeah. That's right.
Okay.
All right.
And which is
HCG, human chorionic gonadotropin.
Yeah.
So
or
that
Pregnil is the
brand name.
name.
So HCG is actually something that pregnant women make. So it's not exactly the same thing, but it does the same thing in both men and women. It upregulates the axis, the loop, the feedback loop. So it increases the signals to tell your testes to produce more testosterone.
Right. And so if you are a guy that is thinking about fertility and also thinking about some sort of ways to increase your testosterone, your provider might recommend something like HCG or Pregnil over, just straight up testosterone replacement.
Yeah. And if you have what's called hypogonadism, is that right? Yeah. So basically meaning you're not producing enough naturally testosterone wise.
Yeah.
That is one of the prescribed treatments.
Yeah.
So you can get insurance to cover that if that's the case.
And it's also another way, like we touched on, just the change in your testicular size. It's another way to kind of, mitigate for that is to take HCG with TRT to maintain, your testicular size.
Right. So you don't get too much atrophy.
Yeah.
Yeah. So those are the things we can do to kind of keep it all going, and also so it stays within all normal limits.
Yeah.
Yeah.
So what else in terms of like peptides, or what else is kind of on the horizon for men?
Well, I mean, there's all kinds of things. I mean, this applies obviously for men and women.
Yeah.
But we're starting to cross over like in the regenerative stuff,
Mhm.
and then like so peptides are all actually still kind of hormones. They're all the peptide
Yeah.
hormones. So a peptide,
Signaling molecules.
right? So
Yeah.
what is a peptide? First of all, a peptide is a very small protein. It's no longer called a protein because a protein has to be a certain number of amino acids in a chain. I think it's 50 or more, I believe.
Yeah.
And a small protein, smaller than that, is a polypeptide, and then smaller than that is called just a peptide. So peptides range anywhere from a couple of amino acids up to, I don't know, 20, 30, 40, something like that.
Yeah.
And they signal various things within your system to turn on or turn off. There's literally, they're switches. They're on and off switches. And they can turn on and turn off all kinds of things. And they regulate all kinds of things in your body. There are hundreds of peptides that have been discovered and created. So there are some synthetic ones too, which are a little more sketch because if they don't naturally exist in our bodies, sometimes it's hard to know exactly what they're doing. They may have multiple effects.
Yeah.
I think the ones that are more naturally occurring are a little bit better. Sometimes they make peptides with side chains so they last longer. One of the problems with peptides in general is their half-lives are really short. When I say half-life, it means their effective lifespan. So sometimes they're literally minutes. You inject it, and within minutes, the effect is gone. So most of the peptides that are available commercially, and when I say commercially, now there's a whole other discussion about gray zone of peptides and which ones are available, which ones the FDA say you can use or can't use, which ones are considered drugs.
Research.
Which ones have patents. And so, like for instance, the GLP-1 receptor agonists are peptides. So is insulin. So is many other hormones and drugs. But having said that, in the biohacking world and the wellness world, peptides have become very popular. You want to mention a few of the ones that are commonly used? And,
So one that we're seeing, or that we've heard a lot about, kind of use in bodybuilders or just people, athletes, is one called BPC 157. So BPC 157 is a proangiogenic molecule. And what do I mean by that? So that means that BP 157 signals new vessel growth and new blood vessel growth in the body, especially in an area of injury. So we know that as part of the healing mechanism, or our body's repair mechanism, we need to bring blood flow to that area. We need blood to bring oxygen to that area, and or other signaling molecules, other inflammatory molecules or anti-inflammatory molecules. And so that new blood vessel growth is one of the key processes. And so BPC 157 upregulates that.
And it's naturally made in our intestine, in our gut.
Yeah.
So it's part of what helps our gut turn over the cells faster, because the gut sheds cells very, very quickly.
Yeah.
That's just part of the way it is.
Yeah.
So so that's an interesting one.
And it actually stands for, which is kind of interesting, body protective complex.
Interesting.
Yeah.
Okay.
So
that
good.
one, So again, all of these are kind of in the gray zone, but I mark my word, one of these, pharmaceutical companies is going to say, look what we've just discovered, this new drug, and it's going to be BPC 157.
And so what are people seeing with this? So people are seeing that, one, they have decreased pain at the site where they maybe had pain previously, where they're injecting. And they're also seeing quicker recovery or healing in areas that maybe were injured, specifically relating to soft tissue, whether that be muscle or ligament or tendon injuries. That's where kind of BPC seems to work.
So the majority of these peptides need to be injected because they don't survive the environment in your stomach. The stomach will break them down. There are some exceptions, and BPC is actually one you can take orally, but most people suggest injecting it, and specifically near the site of injury. So that's supposedly how it's the most effective. Yeah. Okay. All right. So let's just talk a little bit more about peptides. Let's not go into too much. Okay. Partially because it is a gray zone. I mean, one thing I know that is trending at the moment is so-called the Wolverine stack, right? Like that's a Marvel magazine X-Men thing. So why? Because Wolverine heals so fast. He heals almost instantly. So that one it's TB500 and BPC, right? So I mean, it's interesting. Do you know more about TB500? Do you know how it works?
I know a little bit. You might know more about
I
TV.
don't know if I do, honestly. So it's, but it is one that it promotes healing as well.
Repair
So,
and
yeah. So we will get one of these times. We'll get Dr. Brendan Corneen. He's the director of our wellness
he could write.
aspect.
He could write a book on TV 500. Probably.
Yes, I mean he is a wealth of knowledge about all these peptides. But the peptides, there are many peptides out there. They all have a lot of effect. They are not without risk, just like anything in medicine.
Yep.
Anything that has efficacy in general is not without risk.
Mhm.
So these are things that if you decide to start doing, make sure you're doing it with someone who's reputable, who knows what they're doing.
Mm-hmm.
I mean, other ones that we'll talk about at some point, like CJC, Ipamorelin. What's that one? The one that lengthens your telomeres.
It's Alta. I can't remember.
Cut that part out.
Yeah.
Anyway. Oh, you have a phone. You can look it up. All right.
So in terms of male sexual regenerative medicine, so another kind of hot topic is something called the P shot.
Yeah. So the P shot.
Yeah.
Well, I remember there was there's a
G-shot?
female one, right? The
The
female's the
G-shot?
G-shot, right?
Right.
So there's a P shot. So this is this what I think it is?
Yeah.
All right, well, you want to explain?
So we mentioned in
Yeah.
a couple episodes ago, or maybe in the last episode. So PRP is platelet-rich plasma. So this regenerative fluid from our blood that gets spun down and then re-injected. So this is actually being re-injected into the prostate or into the penis.
Okay.
The corpora cavernosum or the
Neither one sounds fun to me, but
yeah. So I guess men are seeing increase libido, just increase in sexual function.
Is it working for erectile dysfunction as well?
Some erectile dysfunction. I know the corpora injections, actual injections into the body of the penis, those have been shown to improve ED.
Yeah.
Because theoretically, with PRP, you're potentially bringing in some stem cell. You're bringing in these growth factors.
Yeah, I mean, it makes a lot of sense because the growth factors can help regulate like all the aspects there in terms of inflammation, turnover of cells, in terms of microvascular blood flow, all that stuff.
Yeah.
So that it makes a lot of sense actually.
Yeah.
So the world of PRP, exosome stem cells, all these types of things.
It's kind of limitless.
Yeah.
Yeah.
So I think what we're really trying to do is to reestablish homeostasis.
Mm-hmm.
So whether it's overall homeostasis or local homeostasis,
right,
and even in terms of needs. So I mean, there's a whole other thing about men's health, like PRP, stem cell, exosomes, all this stuff. It can really help with inflammation, like in knees.
Yeah.
And again, as we get older, there's a lot of young people with joint injuries from sports or otherwise. It can help with inflammation, take away pain, increase function, and just overall make our lives better. Yeah. Now, there's all this research out there too in regenerative medicine where they're trying to grow the actual meniscus back. And they're able to do it in the lab. I don't think they've had a lot of success growing back a true meniscus, but they can cause some repair of the articular cartilage, from what I understand.
Yeah.
Yeah.
No, I think there's a lot of promise, and these are things that have so much potential applicability that we haven't even really scratched the surface.
Oh, truly. I mean, the whole landscape of medicine is going to change.
Yeah.
The landscape of male medicine is going to change,
Yeah.
but just medicine in general, which applies to every human being.
Yeah. One other thing that I've been hearing about and have tried a little bit, and I think there's actually pretty good data on it, and I've just spoke to a urology friend recently on using or taking things like Viagra or Cialis or Tadalafil or Sildenafil for like almost pre-workout or exercise.
Oh, that's interesting.
Yeah. So people are finding that they get a noticeably better pump at the gym.
Okay.
Taking either these two. So classically, these are erectile dysfunction medications that act on the nitric oxide cycle in our blood vessels, mainly our veins, and they're venodilators, so you get more blood flow to an area, and therefore helping with an erection.
Yeah.
So people are taking these almost as a part of their workout exercise regimen.
I've heard of some of this, especially in the bodybuilding world, because they take it before shows.
Yeah.
So they look more vascular,
right?
They're more pumped.
Yeah, but it's definitely becoming more mainstream. I recently asked a friend of mine, a urology friend of mine, if there was any potential, let's say like down the road, once you are old and like maybe need assistance in terms of erections, if
Sure.
there's any chance that like taking these things early on or when you
Mhm.
are young and healthy, could it desensitize
Yeah,
you
make
to
it
them
less
later?
effective. Yeah.
And he actually said the opposite. So it's actually, there's actually more data coming out that
Okay.
because of that systemic increase in blood
Uh-huh.
flow, that these things could actually be protective.
Yeah. Well, it
Yeah.
kind of makes sense.
Yeah.
Like if you never lose it,
Right.
right?
Yeah.
Then you don't have to try to get it back.
Yeah.
Yeah. That
So
makes
kind
sense.
of cool, a cool frontier and an interesting, idea in terms of, again, just overall men's health, men's sexual health.
Mm-hmm.
Yeah.
Okay. So I also wanted to mention some of the other technologies that cross over into the regenerative world, especially for men's health. So for ED, prostate health, that kind of thing, there's actually some data that shows that things like PEMF, pulse electromagnetic field therapy, actually can make a difference. There's this one study I read a number of years ago where they had a bunch of geriatric dogs. It was kind of interesting with large prostates.
Yeah.
So they would measure their pee stream, like how strong the pee stream was.
Yep.
And all these dogs have big prostates. So then they would treat them with these PEMF. So what PEMF is pulse electromagnetic field therapy. It's basically a coil, and it creates a very specific waveform, and that causes microvascular blood flow increase, and some other things too. So these dogs that were treated over a period of time, not only their pee streams improved, but on ultrasound, all their prostates shrank.
Wow.
So I mean, that's a big deal.
Yeah.
So I mean, if it works on a dog, it absolutely should work on a human being.
Yeah.
There are other technologies too, like red light therapy, for instance. So red light therapy may not get all the way down to your prostate, but it can definitely affect external organs. So there's red light and near infrared, which has a little bit more penetration. That will increase microvascular blood flow. It'll increase ATP production, which is important for cellular health. It decreases inflammation.
Yeah.
So all those things will help regulate blood flow in general. So there is good evidence that all these things can contribute to fixing erectile dysfunction, or at least making the situation better. Now, part of the problem with erectile dysfunction, I mean, anyone who has it out there, there's all kinds of reasons for it. There can be psychological reasons, but a lot of times it's physical. When it's a physical reason, it's difficult because it's actual dysfunction of the blood vessels themselves. If it's vascular disease, that can be difficult. But there are some things that also can be done, like chelation therapy. Now there's data to show that this stuff works too. There's calcium chelation, and there's a drug out there. I forget the name of the drug. Can you look up the name of the drug for calcium chelation? EDTA, okay, yeah. So there's so EDTA, for instance, it's actually just a supplement.
Yeah.
But there's also a drug out there too that's is an FDA-approved drug that can reverse calcium deposits in the blood vessels. So that's the kind of stuff that also is starting to become a little bit more mainstream. So, and those are things that we do offer here at SOMA. So you can get like IV therapies of different things and actually turn back some of this stuff. So it's not just we don't just turn back your looks, we also can turn back your physical health.
And correct me if I'm wrong, but even with red light too, isn't it true that if you say like if someone has a red light mask, so not only are you necessarily treating the facial skin, but red light's having a systemic effect on the blood and therefore your whole body.
Yes.
Right. Because there have been studies where they looked at different patches of skin and
that was a really interesting study.
Yeah.
So they did how they designed that study is they took a CO2 laser, like they kind of use for resurfacing, and they burned these various subjects' arms. And they had groups where they would have their control group was the same patient. So one was treated with a red light, and the one was covered. And they had a sham group too that got no treatments at all.
Yeah.
And they found that the patients who got one of them treated but not the other, both of them healed faster.
Yeah.
Which is very interesting.
Right.
So the red light affects the actual cells within your blood, which move around your body and affect the rest of your body.
Yeah.
So I don't know.
We love red light. We do.
Yeah. It makes, and for anyone who's ever tried red light, it's just light. So it doesn't feel like anything's happening. So that's the frustrating thing, I think, for me, to convince me like, no, I promise it's working. But most of us want to feel like it's doing something.
Yeah.
Literally doesn't feel like anything's happening. It feels like you can a light's shining on you, but it actually does do something, and it's measurable and it's scientifically proven. And there are thousands of papers published on the topic. It used to be when I first started this whole adventure, probably 12, 15 years ago,
Yeah.
there was a couple hundred papers. Now there's thousands of papers.
Yeah. It's cool.
Yeah. Oh, and also, of course, for athletic performance.
Yeah.
So red light therapy also, I mean, I know this is Men's Health, so, for those of you who want to be athletes, it will improve your workouts. Yeah. Do it after each workout and your gains will be better, your recoveries will be better.
Do it more.
I know. I have no excuse. I have everything right there.
And, last but not least, we would be a little remiss if we didn't talk about just the overall trends of male plastic surgery.
Yes.
So,
I mean, obviously we're plastic surgeons, so we'll touch on it. Plastic surgery is becoming, well, let's just call it aesthetic treatments, right?
Mm-hmm.
So when I say plastic surgery, I don't mean just the actual surgical procedures, but everything. So it's becoming more popular in the male market, in the male subsection. So I saw this start happening probably 15, 20 years ago, and it's been going up and up ever since.
Yeah.
So it used to be in smaller sub markets, but now it's actually spread out to like most markets. It's not just older men now who, it used to be in the very beginning, it was like older men who wanted to feel younger or look younger, especially to compete in the workplace or in the social circles, like say they're newly single or whatever, similar to women, the same idea. But now we have young men coming in.
Yeah. I think that in the past, men were so afraid that procedures or plastic surgery would feminize them.
Mm-hmm.
That's always the fear, right? And so I feel like we've gotten just better and better at our techniques to maintain the masculine appearance and that integrity. And I think there have been some, pretty prominent public figures. I know, like in the last couple years, Brad Pitt got his neck done and was, out and about, and people saw like, oh my God, like he looks great. He doesn't look weird. He doesn't look effeminate or feminine. He just looks just a little refreshed and a little younger and tighter and lifted. And so I think that more and more like that stigma is going away with the male plastic surgery aspect.
Especially for face. I mean, it's like the fillers and facelifts aspects of things.
Right.
So that's, I think, where most of the fear was, I'm going to make you look like a woman.
Right.
But that's not the case. There are, I mean, of course, as a plastic surgeon, we have to know the technique. The techniques are a little different.
Yeah.
So what we do is different. The goals are different. Yeah. But as long as you know what you're shooting for, we can achieve them.
Yeah. And I think male body contouring too is certainly on the rise. Again, I think our techniques are getting better. Recovery is getting even quicker. And we have all these modalities, these, different post-surgical treatments to expedite recovery. So I think men are more likely to jump into it if they know that they can recover quicker and get back to their life quicker. Yeah. And so we're certainly seeing more body procedures as well.
Yeah. So, I mean, I think as far as procedures in general, I think it's kind of up across all
for sure.
Everywhere. And we have, social media, I think, to like blame or thank for that. But that's a big part of it. I mean, it's just exposure. Like everything else, you see someone else who had it done, and they actually look good.
And just normalizing.
Right. And I think in the past also, when a male had plastic surgery, usually it was the media making fun of them.
Negative.
Like, oh my God, look at that. Now it's changed.
Yeah.
Thankfully.
So, I think that it just shows that men in this day and age, the modern man wants to feel good and wants to also look good and keep up with the female counterparts too.
Yeah. And the younger counterparts too sometimes. Yeah. At least talking about my age group.
No, for sure. And so I think it's only going to lead to, positive changes. And I think it's healthy for men to be open about that. All of this.
Yeah. Who was that? It was Billy Crystal played that one character. He had that one line. It's better to look good than to feel good. Right. I think that has gone away. I do think there was some truth to that. That's why it was so funny. But nowadays, I think it's really about looking good and feeling good. Yeah. All right. Well, I think that wraps up another episode of SOMA Living. Thank you very much, everybody.
Thanks for hanging out. Any
questions at all about this? If there anything we didn't talk about, anything we didn't touch on, please just DM us, give us a call, whatever. And we're happy to, come up with a whole nother episode or just answer some questions.
Yeah. But next time, I think we're going to touch on female sexual health at some point.
Okay.
and go from there.
Okay. Well, we got all kinds of stuff to talk about. So, I promised that this wasn't going to be purely plastic surgery, and it isn't. But it's also not going to be purely health. And so far, we're getting the low-hanging fruit here. So, which is the stuff we know about easily. At some point, we're going to start bringing in people who know more than we do about various things, because we're going to run out of stuff to tell you.
Yeah. Some exciting guests in the pipeline. So definitely stay tuned.
Yeah. All right. Thanks, everybody. See you next time.
Bye.